Hi guys, I'm Dr. Puja. It's in the news. Kylie Jenner has confirmed baby number 2. I want you to know that baby number 2 can sometimes be really different. The entire experience can be very different than being pregnant the first time. So for the next 10-15 minutes, I'm going to answer 10 questions for you and it should be fun. All right, let's take a look at the first question together. So last time I threw up every day for 3 months. Will I go through that again? And what will I say to my child? So this is a wonderful question. This is a great question. So it sounds like you may have had hyperemesis gravidum with the first pregnancy. That basically is where you're just vomiting so much for the first trimester, so for the first 3 months. If you've had it with the first pregnancy, likely you're going to have it with your second pregnancy. There's about a 70% chance that this will occur with the second pregnancy. So what I tell all my patients, what I tell all my friends is that it's really important to actually mentally prepare for this prior to getting into that phase. So what I mean by that is actually start doing these practice exercises with your family right now. So start telling your child, start telling your younger one that, hey, mommy's gonna have these issues that are gonna come about and it's absolutely okay. Mommy's gonna be fine. So definitely give reassurance to your first child. And if you're in the bathroom, it's okay to let the child know, hey, mommy's doing mommy things right now. So with your spouse or your significant other, and even your friends that are really closely involved, it's really important to let even the adults know what to expect so they're not freaking out when you do have to vomit a lot during your first trimester. So a large body of research is actually suggesting that if you start taking your multivitamin about, before 6 weeks of pregnancy, and if you're not smoking, both of these actually decrease the risk of you developing hyperemesis gravidum. So make sure you're taking that multivitamin and make sure you're not smoking. Okay, proper diet. Let's do this. During my first pregnancy, I was totally obsessed with nutrition. Now, I barely have time for my toddler's leftover sandwich crusts. Can I get by? The answer to this very important question is no, absolutely not. When you're pregnant, it is so very important for you to keep an eye on your nutrition. I mean, I know you already know this. Your nutrition is largely what determines the baby's mental status. It determines how well the baby's brain grows. It determines how well the baby's heart grows. So making sure that you're taking care of your physical self by eating well is super important for your baby. So don't just rely on your toddler's crusts. It's super important to take care of your health. So if you do have a hard time with your nutrition, talk to your doctor. They actually may have a nutritional service or a nutritionist that they can refer you to, who can actually help you through this process. So the next question is a really fun question. Will I show or feel the baby move any sooner? So the answer to this is the baby's not going to move any sooner. Usually you're going to start feeling the baby move around 14 weeks or so. What's kind of exciting is that you're kind of mindful of all of those feelings and you're kind of looking ahead and thinking about the baby. So you likely are going to start noticing those things a little bit sooner. One thing that actually does change with the second pregnancy is that you are going to show a little bit sooner. And the reason for that is your abdominal muscles now have a little bit of laxity in them, and that then allows you to show a little bit more. On to the next question. Am I going to gain more weight? So with your second pregnancy, there is actually no physiological reason for you to gain more weight in the second pregnancy as compared to the first pregnancy. What we see a lot of is that women, their level of activity decreases with their second pregnancy. I mean, you're busy with another child, you're busy with other things in your life, so it just becomes a little bit difficult. But what's exciting and what I want you to know is that you don't have to start running a marathon. Simple exercises, just like walking 10 minutes a day, may actually be a really good thing for you to do. So to answer the question, no, you don't necessarily have to gain more weight for your second pregnancy. Okay, next question. Is lifting my heavy toddler okay? So the general answer for this question is yes, lifting your heavy toddler is absolutely fine. The thing to keep in your mind is that, say for example, if you had preterm labor with your first child, Or if you're carrying multiple babies, if you have a multiple, gestation, like if you're carrying twins or triplets, it's really important to talk to your doctor because you may have to actually change some of your lifting techniques. The other thing to keep in mind is that as your belly gets larger and larger, your center of gravity changes. So that's, one of the main reasons why women that are pregnant end up having really, a lot of low back pain. So the key is, yes, be very mindful of your center of gravity. So if you're kind of leaning over, you may tip over. Your balance might not be as strong as it used to be. So the key there is to actually start doing balance exercises and start practicing proper lifting techniques of where you're lifting with your legs. Okay, so the next question is, will my labor be easier? The general answer to that question is yes, the labor should be easier and it should actually be faster. The reason why it's faster is because your cervix and the vaginal area, all of those muscles have actually already stretched a little bit with the first pregnancy. So you're going to be able to go through the stages of labor much quicker with a second pregnancy as opposed to the first pregnancy. So the next question is, I'm still breastfeeding, can I continue? The answer to that is absolutely yes, you can still continue to breastfeed. The thing to keep in mind is that naturally, as you're going through your pregnancy, your quantity of milk production, of lactation, actually decreases. And the taste of the milk becomes a little bit more salty, so children naturally just wean off because they just don't like the taste of it anymore. The thing that I want you to keep in mind is that when this happens, and if this happens to you, it's very normal, it's very natural, it's not your fault, it has nothing to do with you. You could also consider seeing a lactation consultant. So a lot of our patients that are experiencing these issues, either with their first or even with their, second pregnancies, it's always important to have a lactation consultant on your side. Again, it's not your fault. This is something that just naturally happens.